When depression is present with PTSD, suicide is a huge danger. Trauma survivors with PTSD are more prone to contemplate and attempt suicide than those without PTSD. Always, 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 if you have a depressed returned soldier, discuss the possibility of suicide. The discussion of suicide will not cause suicide. That is a myth. If someone gets extremely depressed and you're talking to them and they cannot commit to their own safety, then you have no choice but to call 911. Again, safety is primary. The first treatment goal for PTSD is education for the soldiers and their families. They all need to understand what is happening and to learn that recovery is possible. The next treatment goal is safety. The therapeutic room must be a safe room, and the soldier must be taught how to keep themselves safe when the flashbacks or disturbing thoughts occur. There are many techniques that can be used to teach someone how to ground themselves in the present, in the here and now, so that they are not constantly back on the battlefield. It is only when these first two criteria are met that treatment can continue. The reprocessing of trauma can be done by various techniques, which I'm sure someone else will discuss, which can actually help restore the original neural pathways that were altered during the trauma. Sometimes along with talk therapy, there are physical therapies that can also be utilized. Sometimes medications are utilized, and I believe one of your handouts has the list of approved medications to use for PTSD. It is important that treatment be individually monitored and with safety as a goal. Group, couples, and family counseling can also help the family heal. Your handout should include the actual diagnosis from the DSM-IV on PTSD and the family and PTSD, which was adapted from the Canadian Veterans Association, that gives specific symptoms someone might have and a response that a family member can use to help moderate those symptoms. There's also a list of online resources so you can get more information. I hope this has been helpful.